You're watching the Randy and Christa Show. I'm Randy Alvarez.
I'm Christa Orecchio, and this is news that makes you healthier.
Okay, this is a hot topic, and it's right now, one of the reasons why I wanted to talk about this is because I watched the Today Show, Good Morning America, and there seems to be now this, because of the low carb movement, books like Wheat Belly, a lot of people afraid of gluten. Grocery stores have gluten-free everything now, right? I mean, literally, it's all over the place, gluten-free. Nutritionists that I see, registered dietitians, medical doctors, people on the Dr. Oz show are saying, well, almost laughable, where they say, laughable to them, unless you have celiac, there is no problem with gluten and there's no problem with wheat. This is what I'm hearing them say. So I said, who can we get on here that knows more about gluten and the problems of gluten than anybody you know? And you came up with Dr. Tom O'Brien.
Dr. Tom O'Brien, I would say, is one of the country's foremost authorities on gluten. He can talk about it every which way from Sunday, and he really talks a lot about autoimmune disease and celiac disease, and what he calls non-celiac gluten sensitivity, which is a very real problem. I mean, as a clinician for 10 years running blood work, I will tell you the before and afters for even a gluten sensitivity, not celiac disease, is pretty remarkable in terms of how it can be life-changing.
So your beliefs, if you go to Whole Foods and get their 7-grain whole wheat bread, right? Are you saying that's not a good idea?
I'm saying that's not a good idea. It's really nice to run the blood work and to see how you react to gluten if you have a low, medium, or high sensitivity. And then also quality to me is really important. There's the ancient wheat that we used to eat that never bothered any of us, like even in the Bible, in the Ezekiel verse in the Bible. And then there's the modern hybridized wheat that's causing a whole bunch of problems for giving us brain fog, giving less blood flow to the brain, so we have to drink more coffee and get our hormones out of balance. It's causing our digestive issues and just very slow. Like, food can be your medicine or the slowest form of poison. And if you consume gluten and you have a sensitivity, not celiac, but you keep consuming it on a regular basis, it's a little bit here and there I think is fine, because the body should be strong enough to adapt and survive. But if you keep exposing it to it, it's a slow form of poison.
Okay, so gluten in the modern human diet, people shouldn't be having whole wheat bread. You don't believe that, right?
I don't
believe
it, and the science is there, Randy. I know you've been talking to Bill Davis, right, from Wheat Belly, and the science and the studies show that if you have a piece of wheat bread versus a candy bar, you're going to get a higher, insulin spike from the wheat bread. It's really, so much of it is like what we've done to it.
We're going to have a debate on the show, which I can't wait for, with Barry Sears, who wrote The Zone.
Yeah.
He's a PhD from Harvard, brilliant guy, teaches at Harvard, has sold probably 20 million books. And then you have Wheat Belly, cardiologist, medical doctor, that says there's nothing but science. Barry Sears says, unless you have celiac, don't worry about gluten. I said, but isn't gluten sticky? Doesn't it, grab onto the intestines, the wall? Do you believe it creates a hyperpermeability like leaky gut? No. There's no science. Randy, I'm a science person. That's what Barry Sears tells me. And so I never got his whole explanation because we were talking about something else. So
we need him on this show to talk about that at the same time that we have Wheat Belly on the show, maybe even Dr. Tom O'Brien, and really let them all go and talk about that. I'm gonna ask Tom about Barry Sears.
And Tom O'Brien, by the way, this guy, this is his topic, right? That's all he talks about.
He lectures all over the world on gluten and autoimmune disease.
Okay, good. All right.
And there's new testing. I want to ask him, about the testing, because, in my own clinical practice, I have tested people who have been mistested before and got false negatives on celiac, and it's really a shame. Like, we have to find out the right testing so we can literally save lives.
So there are people that say, well, I already tested for celiac, that wasn't the problem, and there's a new test out that will say, yes, you have celiac.
Yeah, there's like 3 tiers that you have to go through, and just because you might get a negative in one of them doesn't mean that you shouldn't continue to drill down deeper.
Have you taken that test?
Yes.
Okay, so you're fine. You don't have celiac.
No, I have a low sensitivity
Should I take
to
that
gluten.
test?
I don't think you have
I'm
celiac,
too far gone.
Randy.
What do you mean you don't think I have celiac?
No, you shouldn't. So, I interviewed Dr. O'Brien earlier, and I think we should go to the clip, see what he has to say. You're watching the Randy and Christa Show, news that makes you healthier. I'm Christa and we are in for an amazing treat today. We have one of the country's top authorities on gluten with us. We're going to talk all about gluten with my friend, Dr. Tom O'Brien. Tom, welcome to the program.
Thank you, Christa. It's really a pleasure to be here.
We're happy to have you. We're talking about gluten sensitivity and celiac. And isn't it true that a lot of people go undiagnosed and they're not sure what the right testing is to find out if this is an issue for them?
It's a major issue today, and most people who do have a test done, if it comes back negative, they think they're okay. But the problem is with the tests. Those common tests that are done are not sensitive enough to identify all the possible ways that a person may have a problem with gluten.
Okay, so what are the top 5 symptoms somebody has that you say, go check and see if you have a gluten sensitivity?
You know, our doctors were trained that the main problem is in the gut, in the intestines, with bloating and gas and diarrhea. Actually, that was the old school of knowledge. Now we know for every 1 person that has a problem in the gut, there are 8 people that don't. Then the main system of the body is the brain. That's mostly where you'll see it, but it could be the joints, it could be the muscles, it could be the bones, it could be most anywhere.
Okay, so if you have brain fog or memory loss, anything like that, joint pain,
exactly,
and digestive issues, you're going to go and you're going to get tested.
You know, if you pull at a chain, the chain always breaks at the weakest link. It's at one end, the middle, the other end. It's your heart, your brain, your liver, your kidneys. Wherever your genetic weak link is, when you pull on the chain, that's where you're going to get the symptoms. And when you eat a food that you're sensitive to, that's pulling on the chain, because it causes inflammation in your body. So wherever the inflammation's accumulating, the weak link is where you'll have your symptoms.
So let's talk about how do we test for both for celiac, the most accurate testing today, and for non-celiac gluten sensitivity.
Oh my goodness. So with celiac disease, the blood test is called transglutaminase, and it's a really good blood test. There are many studies that show it's 97, 99% accurate, almost 100% all the time. The problem is when the researchers looked at that test to see how valid it was, they used the blood of people with celiac disease. And to be diagnosed with celiac disease, you have to have the end stage. It's called total villus atrophy, when your intestines are worn down. And if you have your intestines completely worn down, then this blood test is really accurate. But if you have partial wearing down in your intestines, or if you have the inflammation and just starting that whole process, the test is only accurate 27 to 32% of the time, which means 7 out of 10 times it comes back and says there's no problem when there really is a problem.
So it's almost worthless to catch it early in that
well,
case. We need more accurate testing.
Early. That's right. So there is more accurate testing now that looks for not only transglutaminase, but the earlier markers for celiac disease. The testing for gluten sensitivity, here's the concept. Protein is like a pearl necklace. Hydrochloric acid undoes the clasp of the pearl. Now you've got this necklace, these pearls. Our enzymes are supposed to act like scissors to cut each of the pearls off. They're called amino acids, and then we absorb those and we make new muscle and new bone and all of that. The problem is that no human has the enzymes to break off the pearls from the gluten proteins of wheat, rye, and barley. We don't have the enzymes. Whether you get sick or not from partial breakdown, it's causing inflammation for everyone. And then you have the straw that broke the camel's back, and the result is now you eventually get your symptoms. So the testing looks at a clump of the pearl necklace. And there are many different clumps. There's over 62 clumps of the pearl necklace from not being broken down completely. All the labs look at one clump. It's called alpha-gliadin. It's a big name, but it's a 33 pearl clump. And if that comes back positive, you got a problem with gluten.
You have a sensitivity to gluten if you come back with alpha-gliadin.
That's correct.
And so then, obviously we have transglutaminase for celiac, but only advanced cases. So then what else is for celiac?
Well, for celiac, there is something called the gliadin transglutaminase complex that it identifies the earlier mechanisms in the gut that are occurring. Simple blood tests to look at the earlier stages of being on the celiac spectrum. As opposed to having celiac disease, which is the end stage. Here's the analogy. We all have had a friend who had a heart attack or a family member and they survived and they come home and they say, my doctor told me I had a previous heart attack. I never knew. Well, how do they know that? It's because the EKGs for the heart showed there's heart damage there. So what if you went to your doctor to see if you have a risk of heart disease, and he did an EKG and it's a normal, so he says, but you have a cholesterol of 350. And he says, no, you don't have any risk of heart disease because there's no damage to your heart. If that's the only test we had to look for heart disease, we'd miss a whole lot of people that were at high risk. The test for celiac looks at the end stage, when the microvilli are all worn down. So the earlier test, the gliadin transglutaminase complex, looks for the earlier stages.
So we can catch it. Now, what are the top, let's say, what are the top 5 things that you see as a clinician when people identify celiac and then get rid of gluten, they identify gluten sensitivity and get rid of gluten? What are the benefits?
The most common system that's affected by a sensitivity to gluten is your brain. And so it can be brain fog, it can be seizures, it can be attention deficit in children or adults where their brains are just not working quite right. Those are the most common symptoms that may come up. Systemically, it's fatigue, just being tired, not feeling well. You can have joint pains, you can have skin lesions, bumps on your skin or rashes.
And you get out the gluten and you see all this reverse.
Oh, we see people with psoriasis reversing their psoriasis or rheumatoid arthritis. Now, you can't change the joint distortions, but the pain will go away or reduce dramatically. And for children who have a sensitivity to gluten and it's affecting their brain, when you put them on a gluten-free diet, the studies are very clear. They do better in school. They get better grades. They're more participatory in the class. You see many better, where the teacher, I've had many patients that say to the parent, you know, your child's new medication is really working well. And the parents say, they're not on any medication. We just changed the diet. And the teachers say, oh, well, whatever you're doing, it's working.
Let food be thy medicine, right?
That's right. That's right.
So Randy and I were talking before the show, and he's been talking with Dr. Barry Sears, who's now saying that if you don't have celiac disease, then the whole gluten wheat-free thing is a fad. And I would love your thoughts on that, a little healthy debate.
There was a lot of discussion a number of months ago on that topic, and a lot of magazine articles came out calling it a fad. I didn't say anything. I was waiting because I knew what was coming. Professor Umberto Volta is the chair of the Celiac Society of Italy. And in Italy, the government designates certain centers, medical centers, as gluten-related disorder specialty centers. There were 37 of them in this study. They looked at 17,000 people. There were 27 gastroenterology centers, 4 pediatric centers, a couple of allergy centers, and then internal medicine centers, a variety of different medical specialty centers. They looked at 17,000 people that thought they may have a sensitivity to gluten that did not have celiac disease. What did they find? 68% of those people reported a lack of well-being. They just didn't feel good. 64% had fatigue. And I don't remember the numbers, but it was brain fog, joint pain, dizziness, skin lesions, asthma. And when they went on a gluten-free diet, they felt better. And these are all patients without celiac disease. So the government designated these centers to study this. They looked at 17,000 people in 37 centers and said, absolutely, some people have this sensitivity to gluten. The old school of thought, the older papers said that if you don't have celiac, you don't have a problem. We now know that's nonsense.
Thank you for responding to that. Okay, so you think it's safe to say, in closing thoughts, that maybe everyone, if they're not feeling a sense of well-being, should at least get tested for gluten since it's such a common sensitivity?
You know, that's exactly right. And my good friend, Dr. Rodney Ford, is a pediatric gastroenterologist in New Zealand, and he's been a spokesperson to check children for years and years. And when asked, well, who should we check? He says, well, anyone who feels sick. If what you're doing to be well is not working, just consider maybe a sensitivity to food is the problem. And just properly check the food. You just have to properly check to see.
I love it. So closing thoughts, you guys, properly check the food and get tested. And now our viewers can go to thedoctor.com and they can download the Conundrum of Gluten Sensitivity so that you can get a recap of this whole show if you think that gluten might be a problem for you. Dr. Tom, thanks for being here.
Thank you, Christa.
I think what Tom O'Brien is espousing is a message that everyone needs to hear.
He's good, yeah. You know, and to hear stories that people, that their symptoms are going away, and that their ADD is going away, that the teachers think it's because of a medication and it's just food. It's amazing. I mean, you see that though in your clinical practice as well.
Yeah, and you think about a child's life being diagnosed with ADHD and then medicated, and what kind of path is that going to put them down? If you could catch it early and put them in another direction, you can really see the trajectory of life goes two very different ways. So that's this type of thing that changes lives and the courses of lives, which is why I think this work is so important.
You know, I was talking to Barry Sears, who wrote The Zone, and he believes in an anti-inflammatory diet. And I know you both agree on that part.
Sure.
Because he's not big on gluten either. He thinks nobody should be eating gluten at all. So my son, go ahead.
Wait a minute, Barry Sears, you just said that he thinks it's fine as long as you don't have celiac disease.
Exactly, but he thinks if your goal is to keep that extra weight off and not raise your insulin levels, to limit it to very little.
We got to have him on the show
right,
and hear it right from his mouth.
But he doesn't really like wheat. He thinks that, that it's bad across the board. But if you're going to have it, have very little, he's saying, and don't worry about its trace,
But didn't you say that he's selling pasta?
He does sell a pasta, but it has one cup. It has, I know you're laughing. I'm not defending him.
Okay.
But it has, in one cup, it has 18 grams of protein. It's a zone favorable meal. And he did something special. He said a little bit of gluten like that. He said, you don't want to live on pasta the rest of your life, but a little bit won't hurt you. But he says if you're trying to lose weight, you better not have any wheat products whatsoever, which is most people.
Yeah.
Most people want that. But what I was going to say about Barry Sears is my 13-year-old son, I have to be careful his friends don't see this, but he likes to be funny in class. Mm-hmm. And, if you're a teacher, even though he is funny and his jokes are good, they don't like that, right? Mm-hmm. And I used to have a little bit of this problem growing up. So Barry Sears convinced me to kind of put him a little bit on an anti-inflammatory diet. Mm-hmm. And I haven't even told you this. Overnight, a week later, teacher writes us a note. It's unbelievable. He's paying attention more.
Really?
His grades have literally, because I've done this for 45 days, his grades have completely gone up 2 grades.
I can't believe you didn't tell me this sooner.
Yeah, it's true. I'll tell you a little bit more about it.
And you gave him fish oil, probably higher doses
we
of fish
gave
oil?
him fish oil, that alone, and he says he's less likely to want to do wisecracks, and he's starting to pay attention and listen. This is according to the teacher. He himself is starting to believe it is a fish oil. Barry Sears said something about fish oil. It's very good, and it's important, the kind of fish oil. But I said, how many fish oils should I give my 13-year-old son? And he said, well, how smart do you want him to be? Right? I thought it was very interesting.
There's a limit. There's a limit to everything.
And it's not high dose. It's very little dose. But the anti-inflammatory diet, the gluten-free diet, is really the key and cornerstone to making that all work. So you and Tom O'Brien, so you think he's the most knowledgeable guy out there on gluten?
Yeah, I really like his analogies, and he's used to teaching and training other doctors who are going out and with patients, but he can still break it down. Or his analogy of the pearl necklace, of really understanding that this can get misdiagnosed, and proper testing, we're only as good as the quality of our testing, and how he was explaining that we don't want to find out when it's already too late and your villi are atrophied that you have celiac disease. We have to go back to the beginning. And the thing is, just like in cancer or anything else, the earlier you catch it, the better it's going to be. And so I think that that's a new trend in testing. And if we can take it from the alternative health field and move it into the mainstream health field, where that is, you go to the doctor and you run a CBC, a complete blood count, every year, right? I'm sure you look at your cholesterol and all that. Why can't we add that? The first meeting with a doctor, if you've never been tested for gluten or celiac issues, you should be tested, and that should be included in that lab work. That's the world I envision, is that we can get the accurate information direct from our regular primary care physician.
Now, you interviewed Tom O'Brien, but I want to know, does he believe then that the whole human race should not have gluten?
Yeah, that's what he said.
So gluten is just not good. So my question is then, why even test? Is that just a leveraging tool for certain people to say, hey, we now know you have a problem?
So you're saying, right, why even test? Is because we're human and we're going to want to have that cake. And sometimes I got to admit, when I'm at Whole Foods, their macaroni and cheese, it calls to me. So we're human and we might eat that every now and then. And it's nice to know, okay, if I came back very high in gluten, you better believe I'm never going to, sneak in a little bite of the macaroni and cheese. But I'm very low in it, so yeah, I'll take it maybe every now and then. And so I think that's really helpful to know. Yeah, I know. Oh my God, I'm human.
But just a little bit, right?
Not much at all.
I do.
I don't keep it in my house. I eat, but but a lot of my friends and family, and I'm from Jersey with Italian family, you know, trying to get them on gluten, off of gluten is kind of tough. So every now and then it sneaks in, maybe, you know, 2% of the time.
So Tom O'Brien, so you literally can waterboard him and he wouldn't take gluten, right? He's he doesn't have any gluten, is that correct?
No, and he invented an enzyme, which I'm going to explain, but called glutenza, which will pulverize the protein in gluten and gluten and dairy within 90 minutes, and it also has probiotics in it, and it also has prebiotics, the starch that's going to help you get rid of it. There's really not many enzymes that can do that, so he will even take that before eating out. He's not celiac, but he's gluten sensitive.
So you can take this.
You eat with him, he asks very pointed questions to the server all the time. You know, was there anything else in this oil that you cooked this that was breaded, you know, asking those questions. And I appreciate that. We want to be able to educate restaurant staff, and so we don't feel like we're being high maintenance when we go out to eat.
So he believes, and this is the part I really want to understand, that as human beings, we don't have the enzymes to break down or digest the gluten. Is that part of the problem as well?
Yeah, it's part of the problem, but the idea is that, yeah, if it's a hybridized form of wheat, the body really can't recognize it, doesn't know what to do with it, builds up antibodies to fight it, and if you can't digest it, most people aren't producing enough digestive enzymes. I don't know anyone who has perfect digestive health, and we need to talk about the whole microbiome in another show. But in terms of if you eat gluten and you're sensitive to it, it doesn't mean that it's just for that day. You could have inflammation. It lights a fire of inflammation that lasts for weeks afterwards. So that's the idea of using something like a vacuum cleaner in the intestines to go get those old molecules that the body's having a hard time getting and clean them up and get them out, so you don't have this inflammation cascade that's now exponentially moving when you had pizza last week and you're still paying for it on some degree a week later.
So closing thoughts. We're out of time.
Closing thoughts. Let food be thy medicine and medicine be thy food. Simple as that.
Great. You've been watching the Randy and Christa Show. I'm Randy Alvarez. News that makes you healthier.